Hello everyone, this is Dr. Sakamoto. Today, I'd like to talk a bit more about meniscus tears, including some real-life cases. First, I'd like to talk about the anatomy of the meniscus. Let's take a look at this illustration. These are the femur and tibia, the bones of the thigh and shin, respectively. The meniscus is an important C-shaped piece of cartilage that sits on top of the tibia, between the femur and the tibia, and is crucial. The meniscus, which is a crescent-shaped cartilage, acts as a cushion to effectively absorb the shock and impact of the knee joint. Meniscus tears are a common injury, especially among athletes. You can tear your meniscus in many different sports, such as jogging, soccer, and golf. For example, you might experience this injury while jogging, playing soccer, or even during a round of golf. It's likely that most professional athletes have experienced some degree of meniscus damage. Just because you have a meniscus tear doesn't mean you'll necessarily feel any pain. It's possible to have a meniscus tear without pain initially, but continued use can cause the tear to grow slightly. Eventually, as the tear worsens, you'll start to feel pain. By that point, you'll start to experience symptoms like catching or clicking when you bend or straighten your knee, a popping sound when you straighten it, and pain when you squat. When the tear reaches that stage, you'll likely need surgery, often an arthroscopic procedure. During arthroscopic surgery for a torn meniscus is often removed. Without the cushioning provided by the meniscus, the cartilage in the knee joint can start to wear away over time. Cartilage wear can lead to knee osteoarthritis and deformity. Severe pain may necessitate knee replacement. This can lead to significant deformity of the knee. If the pain becomes severe and unmanageable, you may eventually need a knee replacement. In my experience, stem cell therapy for meniscus tears has shown some promising results. At our clinic, we've had some success with stem cell therapy for meniscus tears, with many patients experiencing pain relief without undergoing surgery. Let me briefly illustrate with a real-life case. This patient was a man in his 50s who started jogging about a year ago. He gradually developed knee pain and came to our clinic for treatment. So I checked his X-ray and MRI results to understand his knee condition. When I looked at the X-rays, I noticed that the space between the bones in his knee joint was slightly narrower than normal. Based on this, I diagnosed him with early-stage osteoarthritis. The MRI of his knee showed a tear in the meniscus, which is the cartilage that cushions the knee joint. The tear was triangular in shape and appeared to be protruding slightly from the joint. So I proceeded with stem cell therapy for this patient. Here are the MRI results about 6 months after the start of stem cell therapy. The torn part of the meniscus that was protruding outside the joint had regenerated and was now back in its normal position. The meniscus itself also appeared thicker and healthier. About 2 to 3 months after the stem cell therapy, the patient's pain was reduced by half. By 6 months, the pain was almost completely gone. Today, I've briefly discussed stem cell therapy for meniscus tears. As you can indeed see from this case, the number and quality of the cells are absolutely crucial for successful outcomes. Today's topic has been stem cell therapy as a treatment option for meniscus tears. Thank you for watching the video.